Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO of the Windsor-Essex County Health Unit. We would like you to know that we are listening to you. We are trying to address your questions and respond to all of the messages we've been receiving. Our website is being updated multiple times a day to try to answer your questions regarding COVID-19. I will start with our daily update.
The leader has muted your line. To unmute your line, press *6.
We now have 2,792 confirmed cases of COVID-19 in Canada, and 588 of those cases are in Ontario. Chatham-Kent has 2 cases. The state of Michigan now has 1,791 cases, with 563 cases in Detroit. To date, we have 4 confirmed cases of COVID-19 in Windsor-Essex County. Overall, 554 individuals have been tested for COVID-19, and of those tested, 355 tests are pending. These numbers reflect the total amount of testing done in our community, including Windsor Regional Hospital's COVID-19 Assessment Center at the OLEC campus. With increased capacity for testing at the Public Health Lab in London, it is anticipated that waiting times for results will decrease. Please continue to visit WECHU.org for the most current information. If you have traveled outside of Canada and are feeling unwell and need to seek a health assessment for COVID-19, there are 3 options available. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone assessment or a virtual assessment if that is available. They will guide you through next steps, including contacting public health or attending an assessment center. Only people with COVID-19 symptoms will be tested. The criteria for testing includes a person who has fever or cough and any of the following within 14 days prior to the onset of illness: travel outside of Canada, a close contact with a confirmed or probable case, or a close contact with a person with acute respiratory illness who has been to an impacted area. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Thank you. Good morning. So with the 4th case reported in our community, a number of communities across Ontario are reporting community transmission. The risk to Windsor and Essex County residents is increasing. So far, all our confirmed cases have a travel history, but it will be a matter of time when we start to see cases in our community, and we'll start to see community transmission. So I'll pause for a second to explain what community transmission is. Most of these cases, they have some kind of a link with travel or a contact with a confirmed case of COVID-19. When we see a case with no such links, no such travel history, or no contact with a confirmed or a probable case, then it is deemed that it is in our community, and that is why we have to take stronger measures to control it. We have to follow public health recommendations when we start to see community transmission, which is already happening in many of the community, of staying indoors and not going outside unless it is for groceries, pharmacies, or any other critical important work that cannot be done from home. I am urging people to please follow the advice of our public health nurses. If they're asking you to self-isolate for any reason, it is absolutely important that you must self-isolate yourself to protect your family and protect your community. Anyone who has gone to the assessment and testing center and was tested for COVID-19, they must self-isolate themselves until they get their results back. It is important for all of us because the individuals who are tested are probably deemed high risk by the healthcare provider, and they can potentially spread the COVID-19 disease in the community. Until we get their lab results back, they must self-isolate. The long-term care homes received more directives from the ministry to restrict resident movement. Residents of long-term care homes will no longer be able to leave their facility to visit their friends and family. they can go outside as long as they are still in the property. Staffing at the long-term care home is temporarily ordered by the Chief Medical Officer of Health, which gives them more flexibility to free up valuable staff, identify staff priorities, and develop, modify, and implement redeployment plans. Yesterday, we talked about the healthcare workers who work in more than one institution, and I recommend that they should work with their employers to try and work in only one institution. I recognize the important role and contribution of our healthcare workers in providing specialized care to their patients, and I have utmost respect for them. I also recognize that some of these workers are highly specialized and highly trained to perform certain duties that no one else can do, and they may be needed at more than one facility. Let me just be very clear. My recommendation is not to restrict their movement and potentially deprive any of these facilities from these specialized healthcare workers. What I'm recommending is staff that can work easily without causing any risk to patient care should look for ways to work only in one institution. Potentially must do everything to minimize the risk from COVID-19 spread in our healthcare facilities. What I'm recommending is staff that can work easily without causing any. On the same note, I also want to urge the employers in all these settings, all the employers in Windsor-Essex, to ensure that they are still following the public health recommendation when it comes to physical distancing, environmental cleaning, regular screening, and monitoring of employees' symptoms and appropriate personal protective equipment as needed. All of us are in this together, and we must work together to prevent the spread of COVID-19 in our community. Everyone should continue to practice physical distancing, wash hands with soap and water thoroughly and often, cough or sneeze into your sleeves or tissue. Most importantly, if you are sick, please stay home. Keep surfaces clean and disinfected, and protect yourself, your family, and the community. Thank you.
We will now take questions from the media. We'll start with CTV.
Can you tell us a bit more about
The leader has unmuted your line.
who is it, where do they come from?
Hello?
So the fourth case is a person in their 60s. So the question is more details about the case. The fourth case is a person in his 60s, has a travel history outside of Canada, came to Canada, was seen at the assessment and testing center, and got the results back, and we have reached out to all the contacts of this person, and they're all been told to self-isolate as per public health management guidance.
We'll now take a question from Windsor Star.
I'm sorry, I didn't catch the information about the fourth COVID-19 patient. Could you repeat that?
So the fourth case of COVID-19 in our community is a man in his 60s and had a travel history outside of Canada, came back to Canada, developed some symptoms, went to the assessment and testing center, and was tested positive. We have reached out to all the contacts in the community, and they were all advised to self-isolate and self-monitor their symptoms, and if they develop any symptoms, they will have to contact public health or their healthcare provider.
Doctor, on the comments on the community transmission, does community transmission, does the danger of it create a heightened state of awareness? Do we need to be more confined to our residences as a result?
So the question is, with the fear of community transmission, we should be confining more. What the measures we are trying to put in place is to prevent that community transmission from happening in our community. All the cases that we have in our community right now are all travel related, but we are noticing that more and more communities across Ontario and also in Michigan, they are reporting community transmission. So it's just a matter of time that we will get there. So as long as we are all playing our part, well, people who are asked to self-isolate, they're self-isolating, and people who are right now asymptomatic with no, obviously, disease, they still need to be at home to prevent and limit that. As much as we can do to prevent the community transmission in our community, we have to take those action, and that's what we are trying to do right now.
One more question, unrelated thing. If we are confined to our residences, are we allowed to leave the residences for exercise recreation purposes as long as we maintain social distancing?
Well, I think that you have to make a judgment call on that. Obviously, recognizing that people cannot be home 24/7, especially if they're not advised to self-isolate. People who are advised to be self-isolate, that means they are at a high risk, or they may have an infection. All those individuals, they must self-isolate and they shouldn't go out. For everyone else, if they don't have any symptoms and if they can maintain that physical distance from other individuals, and at a time when it's not too many people outside, and if you can protect yourself, you can go for a short walk, but try to limit and restrict that as much as possible.
Any questions from AM 800?
Dr. Ahmed, you mentioned this man in the 60s traveled outside of Canada. Can you mention where outside of Canada? Was it Michigan again? Can you mention any details?
So the question is where outside of Canada. So this gentleman traveled to a different part in the United States.
Any follow-up questions?
And a follow-up, one more question, sorry. Similar to the question I asked yesterday about do you think people are taking it serious? There's photos obviously circulating on social media with people waiting in lines outside of shopping stores and shopping centers. Just your comments on that.
Well, I guess I can't emphasize it much that how important it is for all of us to follow the recommendations to prevent the community transmission. I just touched on that part. People who are not following those recommendations and those advice, they are not acting in the interest of their community, and also they're not doing their social responsibility. We all have a role to play. We have to protect our community, our families, our children. We all have to follow what the recommendations are. This is not something that should be taken lightly. All the measures and action that we are seeing across the world, across the country, across the province, those are all very unprecedented measures. These measures doesn't happen in every day. This is serious stuff. People should understand that, and if they have any question, please go to our website, read some information, and recognize that how important it is for us to monitor and follow those instructions.
Any questions from CBC?
Yeah, I'm just wondering if, as we're hearing more and more about community transmission, there's robotic voice in addition to what else I'm hearing. Can you hear me?
Yeah. Go ahead.
Okay, sorry about that. There's so many sounds coming through this line. I'm just wondering if, as we're hearing more and more about community transmission, if you're going to expand the testing criteria from what it is right now.
So the question is, as we're hearing more about the community transmission and expanding the criteria for lab testing, so what we know is obviously there is now a lab in London that is operating and functional, and they are providing the test results back quickly. We will see a change in the testing criteria and testing guidelines from the ministry soon, and we will have further information to share with the community. At this point, I can say is the testing capacity is increasing across the province, and we'll continue to see an increase. And when that is there, we will be able to do more testing in our community as well.
Okay. And just a follow-up question, I'm wondering if there's any conversation around potentially closing down access to public playgrounds.
So the question is potentially closing access to public playgrounds. Again, we have to do our risk assessment. We have to see what's happening and what's happening in those facilities. Some of these individuals, when they're going outside, they are maintaining their physical distance. They are doing everything that they should, but some are not. So I think it depends on what the risk is, and we will make those recommendations based on those risks.
Thank you.
Any questions from Windsor-Essex.ca?
The President of the United States has said that this will be over by April. What would you say to people who are believing that and how unrealistic that is?
Well, we rely our recommendations, and we base our recommendations based on the science and the epidemiology. based on the epidemiology, even in China, the situation is getting better, but other places are continuing to see some of the increases. So we know that it will take us a little bit of longer than what many people hope to get through this. The key point is what proactive measures we can take to reduce that number, and that is what our focus is right now. So I'm not looking at what the end goal is. I'm just more focused on what we need to do right now, and we're just pushing some of those recommendations forward, which would help us in the long run to reduce the number and reduce the spread in our community.
Any follow-up questions? CTV? Windsor-Star? Okay, seeing none, thank you.
Thank you.
Hello?
Hello, is there a question?
Hi, yes, I'm Jared Wells from Windsor, Canada. I have a question.
Okay.
Yes, have any measures been placed to protect the migrant farm workers in the county from the coronavirus?
So migrant farm workers, we are in contact with the migrant farm workers, migrant farms owners and the association. We have been providing them with the guidance. We have been providing them with the recommendations on what they should do to protect their workers. And we are continuously working with them to reduce the risk and transmission in that population.
Okay, and are you providing any healthcare visits for these farm workers?
So healthcare, we do not provide healthcare services to them, but we do provide recommendations, and we work with the health system partners in Leamington to provide some of those care that they need. And we have a group that we work with to address those needs and concerns.
Okay, and are the employers doing anything in particular to help the migrant workers?
We are working together to make sure that we have a good plan and we have the ability to pick up those cases and individuals if they need care. Migrant farm workers bring unique challenges to our community, which is very different from the rest of the province. We have had several issues in the past and continue to have some of the issues just because of the nature of the diseases that some of these foreign workers bring. And so public health is always on top of many of those situations, but obviously that's a high-risk population, and we are working with them to to reduce the risk to the community.
Okay, thank you very much.
Can I ask one more question, actually?
Sure.
I'm trying to find out if you can add any more to what you said yesterday about the restrictions that you'd like to see at the border beyond what it is right now. I know you're concerned about certain workers crossing the border. What further limitations would you like to see?
I think what we're recommending is to reassess some of these workers if their ability to work in multiple institutions, and if we can try and minimize those movements, it would be in the best interest of our community. We definitely don't want to see our healthcare institution, our long-term care home, seeing the spread of COVID-19. And all these recommendations are aimed towards protecting those institutions and protecting the workers there to make sure that our workers are safe and we are able to provide the care that is needed in our community.
So are you talking about healthcare workers that work both in Windsor-Essex and in Michigan? Is that what you're talking about when you say you want them to maintain one institution that they're working for, but
that's for the
border?
So that's for the healthcare worker, but for all other people who are working across the border, if there's any ability to work from home, or if they have any ability to limit or restrict their movements across the border, I think that's what we should be looking at.
Thank you.
Yep. Ann 800?
I have another question.
Okay, Ann?
I'm just wondering, I'm not sure if I missed this already, but for the confirmed case, what dates did he travel in the States and when was he tested? I'm not sure if I missed that. If I did, I'm sorry.
I don't have that number right in front of me. We can send it to you, Rob.
Okay, thank you.
And I heard one more question.
Yes, please.
Yeah,
Yes.
what's your question?
Sorry, do you hear me?
Yeah, we hear you.
Do you hear me? Okay. So, we've been said by a migrant worker in Leamington that nothing has been done by his employers to protect them from the coronavirus. He also told that if someone speaks about coronavirus, he's going to be fired. What would you say about that?
So I can't speak to any individual situation. We're not aware of that. But as I said, we are working with all these employers of migrant farms. We are working with the municipality. We are also working with the healthcare partners to provide the care that they need. And we are working with them and will continue to work with them to make sure that their needs are met.
Okay, thank you.
So to answer the question about the travel for this gentleman, our fourth case, he returned to Canada on March the 13th and was tested on March 20th.
Thank you, everyone.